When we evaluate the immune system, we're looking at more than symptoms or physical findings. A full assessment often requires diagnostic testing to measure immune competence and detect dysfunction. This may include blood tests, skin tests, or even bone marrow biopsy. Each of these procedures gives us a different perspective on how well the immune system is working. As nurses, it's important to remember that these tests don't just cause physical discomfort. They also bring psychological stress. Patients may feel anxious about the procedures themselves, but often their bigger worry is what the results will mean for their future health, employment, or personal relationships. This is a time when our role extends beyond clinical skills. We provide counseling, education, and emotional support, helping patients process both the testing experience and the uncertainty of waiting for results. Now let's break down the common tests used to evaluate immune function. These can be grouped into categories based on the part of the immune system being measured. Humoral, or antibody-mediated, immunity focuses on B-cell function and antibody production. Tests include B-cell quantification with monoclonal antibodies, measurement of in vivo immunoglobulin synthesis with T-cell subsets, and evaluation of specific antibody responses. Laboratory studies may also include measurement of total serum globulins and the individual immunoglobulins, IgG, IgA, IgIgE, and IgD. Techniques like electrophoresis, immunoelectrophoresis, radial immunodiffusion, nephelometry, and isohemagglutinin testing are used to get precise values. These tests help us determine whether the patient's body is producing and maintaining an adequate antibody defense. Cellular, or cell-mediated immunity, looks at the T-cell side of the immune response. Here, the total lymphocyte count gives us a general measure, but we can get more detailed with T-cell and T-cell subset quantification using monoclonal antibodies. Delayed hypersensitivity skin testing shows us how the body responds to antigen exposure, while cytokine production studies help evaluate communication between immune cells. We may also assess lymphocyte response to mitogens, antigens, and allogeneic cells. And of course, measuring helper and suppressor T-cell functions provides critical insight into immune balance. Together, these humoral and cellular tests give us a picture of whether the immune system is functioning properly, overreacting, or failing to respond. When combined with the health history and physical assessment, they form the basis for diagnosing immune disorders and planning effective care. To summarize, diagnostic evaluation of the immune system involves both laboratory testing and skilled nursing support. Blood tests, skin tests, and bone marrow biopsy provide the scientific data, but the nurse's role is to connect that data to the human experience. By recognizing patient anxiety, offering education, and supporting patients emotionally, nurses bridge the gap between science and care, ensuring that the diagnostic process promotes both understanding and healing.